Pediatric scleroderma is a rare condition that can affect the skin, muscles, and internal organs. Learn more about the advanced care at UPMC Children's Hospital Pittsburgh's Pediatric Scleroderma Clinic and today's Bridging the Great Health Divide. There are two kinds of pediatric scleroderma. Systematic scleroderma affects the whole body, including internal organs, and localized scleroderma, which mostly affects the skin and underlying muscles and tendons. Dr. Catherine Torok is the director of the Pediatric Scleroderma Clinic at UPMC Children's Hospital Pittsburgh. She explains the difference between the two types of scleroderma.
The systemic scleroderma in kids, that's usually skin thickening, kind of at their fingers, and then travels up their arms, and the same thing from their toes up towards the center of their body. And that skin thickening causes them to have trouble closing their hands. It's hard to make a fist. It's hard to write. They'll feel really stiff. They also have some internal organ manifestations that can occur, like lung disease and some heart disease, sometimes in other organs. Whereas the localized scleroderma in kids, which is more common, but still rare, that will kind of show up typically as maybe a bruise that won't go away, and then it'll turn brown into a line, usually down their arm or down their face. And that kind of gets thick like the skin that we talk about in systemic scleroderma, but then it kind of tacks down into the connective tissue, like the joints and tendons.
UPMC Children's Hospital Pittsburgh is one of just a few pediatric scleroderma centers in the nation. Dr. Torok explains that there are two parts to the center.
One is the juvenile onset systemic scleroderma center. So that's where combined multidisciplinary care of pediatric pulmonologists, pediatric cardiologists, pediatric gastroenterologists, myself, the pediatric rheumatologist, and the pediatric bone marrow transplant folks are all working as a team, as a multidisciplinary team that have trained and experience in pediatric scleroderma, which is a rare thing. And then on the other center that we have that's unique at UPMC Children's Hospital Pittsburgh is the craniofacial scleroderma center. So that is for the kids that have the localized scleroderma in the linear band, kind of affecting their face, and then sometimes their eye, brain structures underneath. So that's something unique that's honestly not in the nation for either of those two specific types of pediatric scleroderma centers.
UPMC Children's Hospital Pittsburgh's Pediatric Scleroderma Center is the only one in the nation that has a stem cell transplant program as part of its care options.
And what that is a combination of like chemotherapy and radiation, really to kind of just knock the immune system out because it's, kind of overactive. The immune system's attacking all these organs. We want to stop that immediately. And you're using the patient's own cells that you actually pulled from them before the chemo and everything, and you stored them. It's the own patient's blood that just kind of like reconstitutes and makes a more healthy immune system.
Dr. Torok says the center is also on the leading edge of pediatric scleroderma research.
We're doing biopsies before and after treatment, and we're seeing like what cells change, like fibroblasts or different immune cells in the skin. And that's giving us ideas for, different medicines that may exist right now for different forms of rheumatoid arthritis that we could use against those specific proteins or markers. And also kind of future therapies to test on like mice models and things of that nature.
Dr. Torok says the team approach is what sets UPMC Children's Hospital Pittsburgh apart.
The networking of the clinicians, the nurses, the support care is just amazing. It's all of these pockets at UPMC Children's of specialists that are kind of helping move science forward to help patients with different, diagnoses and diseases to get treatment so the kid can just be a kid and go to school and do sports and just be one like their other peers and, not have to worry about having a chronic illness every day.
To learn more about UPMC Children's Hospital Pittsburgh's Pediatric Scleroderma Center, email greathealthdivide@chp.edu.